Asian American mental health is my passion, and this project has been a dream of mine for the last 2 years, to create a series of filmed interviews with some of the most prominent clinical programs, research centers, and experts in the field of Asian American health and mental health. These videos are for everyone, but especially for trainees, people who are interested in helping the community, and who are searching for inspiration or looking for roadmaps to find their own career paths forward. I interviewed psychiatrists, psychologists, social workers, staff, and other providers, people who are dedicated and doing incredible work in their communities, some who are recognized and some who are behind the scenes. This video is just the highlights. I'm sharing their stories because they have a message for you. This first section is called Inspiration.
Society still, for the most part, believes that doctors are impartial except to further the best interests of their patients. And that is a really important trust that society gives to us. And so when, and I've been to community meetings where policies were, decided, where my testimony to the needs of our underserved communities held a lot of weight because people felt, and I'm honored that they felt this because that's what I try to do, but they felt that I was being impartial and that I just had the best interests of others in mind. And every day we have to check ourselves and see if that day we've earned that trust. And that's, I think that's at the core of a physician's ability to work in the community.
And whether it's George Devereaux or Arthur Kleinman or Byron Good, or even Roberto Luis Fernandez, the head of our center here, whose works have inspired me, one of the things that I keep going back to over and over and over again is how do we sensitize clinicians to the patient's cultural worlds that we see, so that way we can better understand what's normal for them and what's abnormal for them. Because only once we've done that can we then start to tailor our treatment plans to help our patients in the ways that they need in order to be able to live the lives that they want.
Asian American health and mental health have such deep foundations now that it's easy to forget what it was like for those laying the first bricks, the early pioneers. This section is called Challenges.
Maybe a GP, a public health nurse, and a couple of social workers. So somehow we met, and then we had dim sum, and the idea came up from the stories they tell me. You see, I was working in a hospital, but they were working in the community, and they told me of the difficulties Chinese patients would face when they need mental service. But more so than the patient, the families have a hard time if they have a language barrier. So there were cases when a child, for example, was brought to the sick kid hospital, 9-year-old. They said, "We cannot serve you because we cannot talk to your parents."
But at that time when I talk about culture, it's like talking about there's no culture. In fact, in Boston, there was a very prominent psychoanalyst said that everything can be explained through emotions. If you understand how people feel, that's enough. You don't need to understand culture. So, but I was young. Because of my experience of the patients in Asian community in Boston, Chinatown, I was convinced that we need to study culture. But I could not find any references, teaching references. So what I did, I went to NIMH and said, look, I want a grant. I want to submit a grant to pull all the best culturists, best psychiatrists, minority psychiatrists, including Jean Spurlock and other people together, and try to see if we can develop the curriculum material for culture, to include culture in psychiatry. And I use the minority community, the Asian group, Hispanic, Black, and Native American as a paradigm to look at how cultural issues affect these four groups. That was 1972, I believe.
Well, in the late 80s, and this was before the Ryan White CARE Act that President Clinton promoted in 1990. He started that, but this is before the Ryan White CARE Act, when there was not that much advocacy for Asian and Pacific Islander populations. APICHA found it necessary to do outreach in the community, to educate people, to educate the community about the need to come into HIV services. And as we started to do this, we were finding that there were other people who were not being served because of their sexual orientation or their gender identity. And we started to conduct a lot of outreach so that people would avail themselves of medical care and to learn about prevention. After all, HIV is a preventable disease, but it takes a lot of education and outreach in order for people to really learn about the possibilities that exist, especially here at APICHA.
The histories of Asian American health and mental health are illuminated by the ideas and creativity of pioneers, people who fought against inertia, stigma, inequalities, just to name a few. This last section is called Innovations.
I think the major contributions to the first center was to really just put Asian American mental health research on the map. When you look at all the researchers that came from that center, many of them are making substantial contributions to Asian American mental health now. You know, David Takeuchi, Sumi Okazaki, Anna Lau, and so the center has sort of like been a good sports team. You know, they generate better coaches and players, and so who themselves then have started their own teams, and so the center, I think, the first center really set that in motion. In fact, when you talk to a lot of people who went to that center, they say, you know, just the environment, the academic and intellectual environment of being at that center was so different, because most scholars who are focused on cultural diversity feel they're really isolated and sometimes, and many times, marginalized, whereas the center valued that work. And so you clearly weren't in the margins, you were in the mainstream. So it was, you know, you were a mainstream worker within that context.
This trust, the bridging the gap with the healthcare systems, like, which is, I mean, there is a big gap, I could say. That's why we work with the doctors. We visited different doctors, gave them lectures, how to speak with the Bangladeshi community, culturally specific. I mean, what kind of food they eat. I mean, vegetables, what considered as vegetable. A lot of times, a lot of Bangladeshi might be found like they consider like potatoes, and the dal is like vegetables, but it is not, it is carbohydrate totally. So if you ask them, you know, vegetables, so you have to make sure. So that's why we are saying like two prescriptions. One is prescription medications, another prescription which is you have to eat these, do exercise that clearly. And you have to explain like, you know, what A1C level is. Our finding says like, you know, very handful people we found during the survey at the beginning of this project, people do have knowledge about A1C level. So which is really important. If you don't know about your A1C level is, how are you going to manage it, which is the main thing for diabetes. So, and doctor never explained, oh, you are fine, quite fine, you are fine, do exercise. I mean, whatever you do, eat right, do exercise. Eat right means you have to explain what eat right. A lot of our, I mean, many of them, like, you know, doesn't understand exactly, I mean, eat right, what it is. So this is, we educate people. This is the, I would say, like, you know, bridging the gap of the community and the healthcare system.
If you were excited by what you saw and want to learn more about some of the incredible work that's being done in Asian American health and mental health, please check out my YouTube channel at youtube.com/user/AsianAmericanMH. Hope to see you there.